Welcome to the deep dive. There's a conversation absolutely buzzing right now about artificial intelligence,
Mm-hmm.
and it's not just chatbots or, making images anymore.
Right. It feels like it's moving into really serious territory.
Exactly. We're talking about AI stepping into roles that feel profoundly human, deeply complex, and frankly, incredibly high stakes,
Medicine.
like medicine. And so many people are asking, is the AI doctor finally here?
It's the big question on everyone's mind, isn't it?
It really is. So today, our mission is to, well, cut through the noise and unpack some truly cutting-edge research.
Yeah, get to what's actually happening.
Specifically, we're diving into new papers from ArcSev, published just this August 2025, very fresh.
Hot off the virtual press.
And they focus on GPT-5 and its surprising, maybe even astonishing, capabilities in medical reasoning.
Uh-huh.
We're going to give you a clear, well-informed picture of what GPT-5 can actually do in multimodal medical reasoning and, just as importantly, where its limits currently lie.
Setting expectations is key here.
Definitely. Okay, let's unpack this. The whispers about GPT-5 becoming an AI doctor are getting louder, but what does the science really say about it stepping into the complex world of medicine?
That's the perfect place to start. And, the first paper that really anchors this discussion, it's titled Capabilities of GPT-5 on Multimodal Medical Reasoning.
Okay.
And it makes a pretty bold claim right off the bat. It positions GPT-5 as a generalist multimodal reasoner for medical decision support.
Wow, okay. Generalist multimodal reasoner.
That phrase alone tells you we're not just talking about like small tweaks or incremental improvements.
Yeah, it sounds bigger.
We're potentially looking at something transformative for how medical diagnoses and treatments might be approached.
A generalist multimodal reasoner for medical decision support. That sounds incredibly powerful, almost like a digital diagnostician.
It has that feel, yeah.
But for our listeners, what exactly does multimodal medical reasoning really mean? It sounds like more than just, reading a patient's chart.
Oh, absolutely. You're spot on. It's far more than just text. And when we talk about multimodal in medicine, we mean integrating all these different types of information just like a human doctor does.
Right.
So it's not just the patient's written history or the doctor's notes. It also includes structured data think, lab results, vital signs, medication lists.
The numbers, the hard data.
Exactly.
Yep.
And crucially, medical images. X-rays, MRIs, CT scans.
Okay, the visual component. That's huge.
It is. Because medical decision-making almost always requires a physician to pull all these different pieces of the puzzle together at the same time. Cross-referencing, synthesizing.
It's complex.
Very. And that's the complex challenge GPT-5 is being evaluated against here.
And how did it actually do? The paper mentions a systematic evaluation using, let me get this right, zero-shot chain of thought reasoning on both text and visual tasks.
Mm-hmm.
Can you maybe break down what zero-shot and chain of thought mean in this context, and what kind of tests, what benchmarks were they actually using?
Yeah, excellent question, because those terms are really key to understanding what it can do.
Right.
So zero-shot means the AI tackles new problems without specific prior training on that exact task or medical condition.
Ah, okay. So it's not like it crammed for one specific test.
Precisely. It's relying on its vast general knowledge, much like, say, an experienced doctor encountering a rare case for the first time. It generalizes.
Okay, makes sense. And chain of thought.
Chain of thought means the AI isn't just spitting out an answer. It's showing its work. It's step-by-step reasoning process.
Which is critical in medicine. You need to know why.
Absolutely vital. It makes the decision logic transparent.
Okay. And the benchmarks, what did they throw at it?
They cast a really wide net, used some rigorous benchmarks. There was MedQA, which is general medical knowledge, MedExpert QA, which has both text and multimodal versions, so it brings in those images, MMLU medical subsets, USMLE self-assessment exams.
Whoa, like the medical licensing exams.
Essentially mock versions, yeah, high standard, and VQA RAD specifically for visual question answering in radiology, looking at scans.
Got it, so a real gauntlet.
Definitely. And the consistent finding across all these diverse high-stakes benchmarks, it was genuinely striking.
Okay.
GPT-5 consistently outperforms all baselines.
All of them.
All of them, including its smaller siblings like GPT-5 Mini and Nano, and even its powerful predecessor, GPT-4o from, November 2024.
Wow.
It achieved state-of-the-art accuracy across all QA benchmarks and delivered substantial gains in multimodal reasoning, that integration piece.
Consistently outperforms all baselines is impressive enough when you're talking about other really advanced AI models.
Right.
But here's where it gets really interesting for me. Not just beating other AIs, What about human experts? Did it cross that threshold? Because that's a whole different league.
And this is truly the headline finding from that first paper, particularly on the MedExpert QA multimodal benchmark.
Okay, lay it on us.
GPT-5 improved its reasoning scores by, get this, 29.26%.
29%.
And its understanding scores by 26.18% over GPT-4o.
That's not incremental.
No. To put that in perspective, it's like suddenly having a tool that can diagnose nearly a third more complex cases correctly than the previous best AI. In medicine, where even tiny percentage gains matter hugely.
It's potentially life-saving.
It's a monumental leap.
Okay.
But here's the kicker.
Oh.
It surpassed pre-licensed human experts.
Wait, surpassed humans?
These are medical professionals on the cusp of getting their full licenses. It beat them by 24.23% in reasoning and 29.40% in understanding on these specific benchmarks.
Wow. Okay, that's significant.
A qualitative shift. And in stark contrast, GPT-4o, while capable, it generally remained below human expert performance in most of those dimensions.
So GPT-5 really broke through a barrier there. It's not just a minor improvement, it's a profound leap, especially beating human-level benchmarks. What did the paper conclude about its potential then?
Well, they highlighted a case study, a representative example, where GPT-5 effectively integrated visual cues from an image with text information. It built a coherent diagnostic reasoning chain.
So it connected the dots.
Exactly. And then it went on to recommend appropriate high-stakes interventions.
So not just diagnosis, but suggesting action.
Right. Demonstrating it can synthesize information into actionable insights. So the paper's conclusion is crystal clear. On these controlled multimodal reasoning benchmarks, GPT-5 moves from human comparable to above human expert performance.
Above human expert, that phrase just hangs in the air.
It does, and they state this has substantial implications for the design of future clinical decision support systems, suggesting AI could become this incredibly powerful co-pilot in the diagnostic process.
That's a profound statement. Above human expert performance on these benchmarks. It really makes you wonder how these general abilities translate when you get into the weeds. Specific, incredibly high-stakes fields. Let's talk about areas like radiology and oncology, where interpreting images precisely, complex data, it's literally life or death. How does GPT-5 fare when you throw it into those deep, specialized waters?
It's the natural next question,
Yeah.
right? And a necessary one for evaluation. So another recent paper, benchmarking GPT-5 for zero-shot multimodal medical reasoning in radiology and radiation oncology, dives into exactly that.
Okay, radiology and radiation oncology.
Yeah, and these fields are unique because they demand integrating images, the text reports that go with them, quantitative data, numbers, physics, under high-stakes conditions, as the paper puts it.
Okay, so what specific tests did they design for this? How did they challenge GPT-5 in these critical areas?
They did a targeted zero-shot evaluation, again, comparing GPT-5 and its smaller versions against GPT-4o.
Right.
Across three very specific tasks. First, VQA-RD, that's visual question answering in radiology, basically asking the AI to interpret an X-ray or scan.
Makes sense.
Second, SLAKE, that's a multilingual VQA dataset, tests understanding across modalities and even languages.
Interesting. Multilingual.
And third, this one's really fascinating, a curated medical physics board examination style dataset.
A board exam? Seriously?
Yeah, 150 multiple choice questions covering things like treatment planning, dosimetry, imaging physics, quality assurance, highly specialized stuff.
Stuff that human experts in radiation oncology and medical physics need to know to get certified.
Precisely. A very high bar, often quantitative, calculation-based questions too.
Okay. And the results. Did GPT-5 keep up its winning streak in these super specialized fields, even on something as tough as a medical physics board exam?
It absolutely did. Across all those data sets, GPT-5 got the highest accuracy.
Yeah, it had.
And the gains over GPT-4o were significant, especially in VQA-RD. Looking at those scans, it showed up to plus 20.00% in challenging anatomical regions such as the chest mediastinal.
Okay, complex areas.
Plus 13.60% in lung-focused questions, and plus 11.44% in brain tissue interpretation. These are subtle, complex areas where diagnostic accuracy is absolutely crucial.
The stakes there are serious.
Very serious. But the really eye-opening result for me was that medical physics board exam.
Yeah. What happened there?
GPT-5 achieved an astonishing 90.7% accuracy.
90%.
136 out of 150 questions correct. And this exceeded the estimated human passing threshold for that exam.
It passed the board exam. better than the passing grade for humans.
While GPT-4o's trailed significantly at 78.0%. Still good,
Mm.
but not in the same league on this test.
Wow. So it basically aced a specialized medical board exam that human experts find challenging. That's
It
remarkable.
really is.
And it truly highlights its potential, as the paper says, to augment expert workflows in medical imaging and therapeutic physics. You can really see how this could assist professionals, maybe make complex things faster, safer even.
It certainly makes you think.
Mm-hmm.
But to add another layer of nuance here, another wrinkle in our deep dive,
Okay.
we also look at a third paper, Performance of GPT-5 in Brain Tumor MRI Reasoning.
Brain tumor MRIs, okay, that's about as specific and high stakes as it gets.
Absolutely. Interpreting those scans is critical for guiding treatment planning in neuro-oncology.
Yeah.
The stakes literally couldn't be higher for patients.
And the approach here, similar tests.
Yes, a visual question answering or VQA approach, but on a very specific, very challenging benchmark. They curated a brain tumor VQA dataset using 3 established brain tumor segmentation datasets, Bratua's datasets,
Okay.
covering glioblastoma, meningioma, brain metastases. And these weren't just simple images. Each case included multi-sequence MRI triplanar mosaics.
Multi-sequence MRI triplanar mosaics. Can you unpack that a bit? Sounds incredibly detailed.
It is. Think of incredibly detailed multi-layered MRI scans, taken for different angles, axial, sagittal, coronal, so top, down, side, front.
A full 3D picture almost.
Exactly. And using different scanning techniques or sequences. Each sequence highlights different tissue properties. It gives us a really comprehensive view of the brain and any abnormalities.
What neuro-oncologists use day to day.
Precisely. It's what they rely on to pinpoint tumors, understand their characteristics, and plan treatments down to the millimeter. So the very high bar, real-world test for AI interpretation. And again, models assess zero-shot, chain of thought, looking at accuracy.
Okay, extremely specific, very detailed image interpretation, mimicking real clinical scenarios. How did GPT-5 and its variants do on this highly critical task?
Well, the performance figures here were interesting,
Ah.
and they reveal an important nuance.
Uh-oh. I sense a butt.
A bit of one. GPT-5 Mini, the smaller version, actually got the highest macro average accuracy at 44.19%.
The mini version did best.
In this specific test, yes. Followed closely by the main GPT-5 at 43.71%, then GPT-4o at 41.49%, and GPT-5 Nano way down at 35.85%.
So mid-40s percentages.
Right. And what's fascinating here is, while the model showed, moderate accuracy, the paper itself concludes these results are not at a level acceptable for clinical use.
Not acceptable for clinical use. Okay.
And it also highlighted that performance varied quite a bit by the type of brain tumor. No single model was best across all the different cohorts.
So what does this all mean then? It feels a bit confusing. We have one study saying GPT-5 is above human expert performance on general medical reasoning, passing board exams, and another saying its performance on something like brain tumor MRI reasoning is not at a level acceptable for clinical use. To a listener, that sounds like a direct contradiction. Can you help us square that?
That's an excellent question. And it's crucial because it highlights a critical point in evaluating AI, especially in medicine.
Right.
GPT-5 shows remarkable progress, truly. And it can indeed surpass human performance on controlled benchmarks and on specific, well-defined tasks, like passing a board exam with multiple-choice structured questions.
Okay.
The general medical reasoning paper shows it can integrate diverse data types very effectively on those tests. However,
There it comes.
the brain tumor MRI study illustrates that it's not some universal AI doctor ready to be deployed without human oversight.
Yeah.
Particularly in these highly nuanced, critical diagnostic areas where you need absolute precision for every single unique case.
So the type of task matters hugely.
Hugely. Think of it this way. Passing a board exam means you grasp the fundamental principles. You can apply them to typical, well-defined problems. That's what exams test. But interpreting a unique, complex brain tumor MRI in a real patient, that involves navigating subtle ambiguities, maybe artifacts in the scan, integrating a vast array of individual patient factors, dealing with potentially imperfect data.
The messy real world.
Exactly. The kind of edge cases where even human experts might consult each other or debate the findings. The sheer complexity and variability of real-world clinical cases, especially something as intricate as brain tumors, means that moderate accuracy Even in the 40s percentile just isn't good enough when a patient's life and treatment plan are on the line.
So it's less of a contradiction and more about context and the level of precision needed for different medical applications.
Precisely that.
It's like, oh, maybe it's an incredibly skilled, highly specialized diagnostic assistant, but not yet a standalone practitioner who can handle every complex, ambiguous case perfectly on their own.
That's a great way to put it. We're looking at GPT-5 as an incredibly powerful tool for clinical decision support systems, for augmenting expert workflows.
Empowering the humans.
Exactly. Empowering humans with these unparalleled analytical capabilities rather than replacing them. Think about fields like radiology and oncology. The sheer volume of data is immense. The decisions are critical.
Overwhelming sometimes, I imagine.
It can be. So having an AI that can quickly synthesize information, maybe flag subtle details humans might miss after looking at hundreds of scans, even answer complex board-style questions to refresh knowledge, that frees up human experts.
Frees them up to do what?
To focus on the truly complex, ambiguous, or rare cases. The ones that still defy easy algorithmic interpretation, the human interaction part. It helps humans make better, faster, more informed decisions. It pushes the boundaries of what's possible in medicine together.
And that really brings it back to the importance of how we apply this knowledge. Engaging in critical thinking about what these tools are truly capable of and where they fit best. The AI doctor might not be a single autonomous entity, but maybe more like an incredibly powerful partner in care.
I think that's the right perspective based on this current research.
So, to sum it all up then, GPT-5 represents a truly groundbreaking step forward in AI's medical capabilities, especially its multimodal reasoning, pulling together text, data, images, and its demonstrated ability to excel in specific, challenging medical tasks, even passing specialized board exams.
Quite remarkable achievement.
It definitely shows us a future where AI can significantly empower medical professionals, making healthcare potentially more efficient, maybe more accurate in certain areas. It's not necessarily about AI replacing human doctors, but perhaps AI profoundly enhancing their ability to deliver care.
Augmentation, not replacement, seems to be the theme.
Which raises an important question for all of us listening. As AI continues to evolve so rapidly, how might you imagine your own healthcare journey being transformed in the next few years by these kinds of intelligence systems?
This is worth thinking about.
Or maybe consider how this level of AI insight might change what it even means to be a doctor. Perhaps shifting the focus even more onto that unique human connection, empathy, and handling those complex, nuanced cases that still, for now, defy algorithmic precision.
A fascinating thought.
We really encourage you to reflect on this rapidly evolving landscape of AI in medicine. It's changing fast.
Faster than we might realize.